I'm Meyer. I'm a practicing physician in the Sacramento area for more than 30 years. During this time, I've had the chance to observe many things that increase healthcare costs. Among these, extreme cost of drugs. Now, drugs, when they first introduced, are proprietary, and they have to cover the cost of developing the drugs, which usually is well over $1 million or $2. And then after the patent goes off at 17 or 20 years, then they come down significantly in price. And this is not generally appreciated by most physicians even, as well as other people. And such glib comments as to toss those drugs into the toilet and not keep them is not appropriate. Medical Letter did a study in the late 1990s on how good are drugs in this country. And they found out that most drugs are good and hold their potency for about 5 years after the expiration date. And well, why is expiration date so short? Well, the government makes sure the pharmaceuticals toe a very thin line on the potency, and if it varies more than a few percent, then the government will take the pharmaceutical company to task. But there's no significant loss in the potency over the first 5 years. The Medical Letter did another study in the early 2000s, I believe it was around 2004, and they came up that most American drugs now are good for 10 years after the expiration date, except for liquids which do not or should not be used much longer than expiration date. And so drugs in your medicine cabinet are good for a long time. I have an allergic reaction myself here a while back, and prednisone in my cabinet had expired in 1998, and there were 20 milligram tablets, so I took a couple of those, you know, and I'm sure they're not 20 milligram potency, but maybe only 15 or so, but it certainly did the job and got over my allergic reaction very quickly. So one has to look at the cost benefits here, and to glibly tell patients to throw it away is not appropriate. The big difference in this is also the difference in price. The drugs for heartburns, such as Tagamet, Zantac, Pepcid, were the $4 drugs in 1980s. And now they're over the counter, and you can buy 120 or so, maybe for $10. An extremely drop in price. And we have now the new proton pump inhibitors that eliminate all acid production, pepsin and what have you in the stomach. Much more effective, and they came out in the last decade, and they were about $5 a pill, or about $120, $50 a month. And these are now becoming generic in the last year, and most of them are down to about 50 cents or 40 cents a pill, or roughly about $15 a month from $150. So they're very cheap. In fact, generic drugs in this country are probably more inexpensive than any place else in the world. Frequently still see doctors, or that I had an example of a patient who had two perfectly good acid-reducing drugs, and they were sent to a gastroenterologist who told them to toss those drugs away and start using Prilosec, or one of the newer drugs, proton pump inhibitors. And of course, there's not a whole lot of money in this day and age, but the very concept of tossing drugs in the toilet is probably something that should not happen. It creates a culture there of it's not expensive and to be tossed, and it's not good for the sewage system in our country also. So be very careful before you toss drugs, and most drugs you can hang on and continue to use for the same problem for which they were prescribed for many years. You may find many of these things on my website, medicaltuesday.net, where we have a weekly or bi-weekly column which goes over many of these things on a regular basis. Thank you for tuning in today, and we'll be back with you shortly with another message.